I've probably sent 1,000 children to the operating room. And what I will say is when it's your child, it's different. When she was 5, she was snoring like a 70-year-old lady, and I knew she probably had some component of sleep apnea, so she needed her adenoids out. I'm probably going to get emotional now. It was one of the more challenging things that I've ever done in my life.
My son Luke, who was 6 months at the time, was developing respiratory distress at home and brought him in through the ER here and was escalated on respiratory support requiring PICU level care. I feel like I was paralyzed in fear in the ED. My husband was out of town, so I think being sleep deprived, trying to figure out what to do with my other son while holding the basic baby in my arms was really difficult.
One day, around 4 weeks of age, I noticed that her left upper eyelid seemed to be a little bit more puffy than the right. As the days went by week 5, I saw a little detail on her left upper eyelid that looked a little blue. And that's when I sent a picture to my boss, who's a pediatric dermatologist here at Children's. And I said, I think Luana has an infantile hemangioma on her left upper eyelid. And her response was, bring her to clinic tomorrow. I was like, I wanted for her to tell me that I was wrong. So that's when I became a parent of a patient, first mom, anxious mom, because, I knew what the consequences were of having an infantile hemangioma that could impact vision long term.
My son was pretty sick, and ultimately he was diagnosed with acute cereballitis and meningoencephalitis. He was 3, and so we got to experience the whole inpatient experience from emergency room, ambulance ride, floor patient. We got 2 RRTs called on us, so it was much easier being on the other side and coordinating the care than being the side where you're receiving the care.
Pediatrician listened to his lungs and said he is having asthma attack or some sort of respiratory attack, and he needs to go to the ER now. And I know the system, and I am familiar with these sorts of problems, but to have it happen to your kid, like out of the blue, was terrifying.
A lot of my time is spent caring for people on the inpatient unit, but I had never personally or with him spent any time on the inpatient unit, and so that was very eye-opening to me, just truly understanding the lack of sleep and how that 10 or 15 minutes that you see the attending physician is so meaningful, and how the difficulty with planning your day and sleeping. And I also am a very non-anxious physician, and it turns out I'm a very anxious mom, and so it made me much more empathetic to my families that kind of react really strongly to things that I think are not stressful. When you're the one that's been up all night with the screaming child and you call and the doctor says, this is all expected as part of the disease process, I phrase it now in a slightly different way.
I would say being on the other side of the door has given me a new perspective for taking care of my patients. I know I meet most of them and their families on the worst day of their lives. To be able to have that experience, to know how scary it can be, and to be empathetic, I try and channel that same knowledge and experience every time that I meet my patients.
And as a provider, it's allowed me to connect better with my patients and to also reassure them that even though this is a treatment and this is a pathology that we can treat, I'm going to be with them every step of the way, as the providers here at Children's Hospital were with me.
I'm not patient-facing. I'm sitting in a room away from the hustle and bustle of the ER or the ICU, and I'm looking at studies and rendering interpretations, and I know that this is what I can do to help them, and it is 10 times more stressful to have the patient in front of you really sick, maybe not knowing what's going on and needing help making them better. That's the core work, right? Making the patient better, helping parents who are dealing with one of the scariest times in their lives get through it.
Because of this whole experience, it's made me more aware of checking in with the parents and then trying to find resources.
If you have children, it's your most prized possession, right? And I have a newfound respect for parents, especially parents sending their children to the operating room. It's scary, and I get it now.